who actually think outside the box and do something other than what Big Pharma tells them to do?
I would say the best answer as of right now would be my nonprofit organization, co-founded by Professor Paul Marik. We have done an immense amount of work at looking at the role of safe, available, repurposed medicines in a number of disease models, and I think that would be the start of a resource. But we're just a little nonprofit. This is a major issue that affects a massive population, not only in the U.S. but around the world, and clearly we need more resources put to this, to the study of these medicines. And as my colleagues have alluded, there's just no financial incentive to do that for those that control literally public health and medicine in general. This is the enemy. This is the Achilles heel of the entire pharmaceutical industry. They are terrified of repurposed drugs. You will never get a repurposed drug to reach regulatory approval if there's more profitable alternatives.
Mr. McKiernan has a question.
Yes, I just wanted to highlight the asymmetry in the publication that's going on here, because Del brought up this great paper of 99 million patients. If you go to that paper, it was a $10 million study, and it was funded by the CDC and HHS, which both have, HHS has $400 million in vaccine royalty, and CDC, we heard from Brian Hooker, has vaccine money. And yet their paper is heralded all over the place, and if you look at that paper, it says data not available. I worked on the Human Genome Project with taxpayer-funded money. We put data public every 24 hours when we did this. And then folks like yourself, Sabine and Jessica and Pierre, you put data out and you get retracted. And your data is available. So there's just a massive asymmetry in peer review right now that is also captured and is a topic that needs to be addressed.
Thank you all. Our next presenter is Dr. Christian Perronne, MD and PhD. He is a professor of infectious disease in Paris. He was chairman of official committees on vaccination and communicable diseases. He was vice chairman of the European Vaccination Group at the World Health Organization. Dr. Perronne, and tell me how to pronounce that if I'm pronouncing it incorrectly.
Thank you, Senator. So, at the very beginning of the COVID crisis, I realized that dissenting opinions were subjected to pressure and even threats, and I experienced that myself. Because I was considered at that time, because during 15 years I was working with the different ministers as a nice guy and a competent expert. And from one day to another, they wanted to suppress my voice, and I was a dangerous person. And in 2020, we published with colleagues of my department our fantastic experience with the combination of hydroxychloroquine and azithromycin. We had the lowest mortality in all the Paris area and the lowest in France, just like Didier Raoult in Marseille. So that was unacceptable for the authorities. They made pressure on my colleagues. They were threatened for their career. We had to withdraw the article. For me, it was terrible. And as a reward, also, I was fired from my position of head of the infectious disease department of my hospital, position which I occupied for 26 years. And at that time, I saw that many fake data and even fraudulent articles were published, even in the major medical journals. For me, it was really a terrible problem. And you all know about the first big scandal, the so-called Lancet Gate, where the Lancet journal published a so-called huge study demonstrating that hydroxychloroquine was not effective and very dangerous. It appeared rapidly that it was fraudulent. It was also acknowledged by the authors, by the journal, but our Minister of Health at that time, Olivier Véran, the day after the publication of the Lancet study, signed a decree, I don't know the name in English, a decree, something like that, to forbid the prescription of hydroxychloroquine in France for GPs. And when a few days later it was published worldwide that the article was fraudulent, he never suppressed his what he just signed before. So I said in the French media at the end of June 2020 that the government was responsible for around 25,000 excess deaths in France due to the lack of possibility to prescribe hydroxychloroquine. So, of course, we wanted to to block my voice in the media, and they succeeded. So with some experts from different backgrounds, we created an association, non-profit association called bonsens.org. Bon sens in French means common sense, because we analyzed all the medical publications, and when we saw data that were not realistic, fake data, or also fraudulent articles, we responded by publishing articles in peer-reviewed journals. And it was much more powerful to protest that way, just to shout on the TV. And we did that, and I thank all my colleagues who did that. And also, we filed complaints, so legal actions, to attack some decisions of the government to support the victims of the so-called vaccine. The problem is when a fake information is present in the medical journals, all the public media relay that in the worldwide, but when we publish a counter-expertise with the truth, nobody speaks about it, or they say, oh no, it's just fake information. So now our goal is to keep the possibility to have good communication, because now I'm censored on all the mainstream TV. You know that in France there's an agency called ARCOM, who was created to protect the transparency, independence of media, but they made a press release more than 2 years ago to say if you continue to invite Professor Perronne, you'll have a huge fine. And one TV channel had a fine because they invited me. Now they don't invite me anymore. So I'm going on alternative media, but also my Facebook page was closed during 1.5 years. And now if I appear on YouTube, on a video, on an interview, usually when they say my name, in less than 24 hours, it is suppressed. So fortunately, some alternative media support our fight, and I want to thank François. It's a nice French newspaper created during World War II by French resistance during the war. So this journal is very active, and there are a few alternative media who help me. And I would like to end by a word about now the French authorities are reinforcing their fight against freedom, and especially freedom of speech. So in December 2023, very recently, President Macron created a presidential, not national, the Presidential Council for Science. Now he can decide what is science or not. That's surprising. And just recently, a few days ago, a vote was passed in France to condemn people who don't follow the current medical knowledge or the medical consensus, and the penalty could be prison 1 to 3 years, and a huge fine between 15,000 or 45,000 euros. The Senate, because here we are in the Senate in France, rejected the law, but it came back to the National Assembly, which voted it. But at the reverse of the United States, in France, the National Assembly, like the House of Representatives, predominates on the Senate. So it's a pity, but it's like that. So that's the words I wanted to say, and we have to keep united. It's a symbol of liberty here in Washington, and with France, we have old relationship, and with all other countries, we have to continue this fight for freedom. Thank you.
So, Dr. Perronne, I mean, so you had a held position for 36 years, and because you treated patients, you had the courage and compassion to treat patients, you were fired.
Yeah.
And we've heard that before here in the States. I think the assumption here is we have these vaccine manufacturers here that have a lot of power. They spend billions of dollars to control the narrative. But that's not necessarily the case with the COVID vaccine in France. I mean, you've got, 2 big ones here in the States plus BioNTech in Germany. What was the powerful interests sabotaging early treatment in France?
The powerful?
The powerful interest. I mean, if it wasn't the vaccine manufacturers, which you don't have in this case in France, I mean, is it the media? Is the World Health Organization? I mean, what elite group created the environment to, first of all, pass that obnoxious law against free speech? What's happening in France? I mean, who's pulling the strings there?
What's happened is the media are completely under control of the authorities. So all the dissident voices are suppressed, and they favor on the TV some so-called key opinion leaders who are, some of them, corrupted. And alone with a few colleagues, it's very difficult to fight against this whole of an environment.
So do you view that just as a global movement that also has an impact in France? And
it's global. It's not only France, because we could see that the same decisions were taken the same day in France, in Australia, in Sweden, everywhere. And I wrote 3 books also, so that was embarrassing for my government about the COVID crisis. They were bestsellers in France. And in one of the books, I say that the McKinsey company had the employees inside the ministers, and I had the proof of the Minister of Health, and they have official letters with Mr. X, civil servant of the ministry, and in fact, they are not civil servants, they are paid by McKinsey. And McKinsey is writing, and the other consult companies are writing many official texts. So I wrote that in my book. I was never attacked because I had the proofs.
Okay, well, thank you for having the courage and compassion to treat patients. Our next presenter is Dr. Ralph Lataster, PhD. He's a Bachelor of Pharmacy, PhD lecturer and researcher on misinformation, now mostly on COVID, typically at the University of Sydney and running OKThenNews.com. Dr. Lataster.
Thank you for your efforts, Senator, including your endorsement of intellectual humility. We all understand the challenges that you face, and I ask you that you please persevere, because what happens in the US affects us all around the world. All right, to give you a little bit of context, global policies around COVID-19 vaccines were, of course, dictatorial and discriminatory, leading to the persecution of unvaccinated people such as myself, and also leading to vaccine injuries. These policies were justified via claims about the vaccines' effectiveness and safety. Now, recent research published in major medical journals reveals that these claims were highly exaggerated, particularly 4 articles by BMJ editor Peter Doshi of the University of